And it ended with the parliament member asking the protocol, the one that wrote the protocol, please state in the protocol that I harshly object this saying, especially when coming from a social services representative. So what comes out of this is that it's very hard to talk about everything you just talked about. It's really, really hard, and we called it the denied link. And you gave us the link, but it's actually denied, and it's very hard to talk about it. And I'll try now to talk about why it's so hard to see the link and why it's so hard to talk about it. And I'll do it in a micro level and in a micro level. I'll try. And first I want to say a couple of things I already said, so I won't go back. It's a groundbreaking project, provides us an empirical base for policy. It makes the denied evident, and it helps us reframe child protection, and it helps us reframe risk, and that's a huge thing, And how can it help us reframe? You say the paradigm shift. I'm in the midst of conceptualizing how it can help us, and I tried to build on Michal's, paradigm. So the conservative paradigm tells us that risk is the consequence of insufficient parenting, parental pathologies, and psychological deficiencies. We talked about it a bit, I won't elaborate now. What the Child Welfare and Equality Project helps us is saying that risk is the consequence of societal inequality manifested in the child welfare system. This gives us the structural frame for what is risk and what is children at risk and what are parents at risk. And what the PEP, I think, can add or maybe help put another layer on it is to say that risk is multidimensional and contextual. What I told Anna yesterday that I took her systemic causation, and then she told me it's Breed.
And Breed, you said it's George Lakoff.
It's George Lakoff, okay, so we do the credits right. And in this paradigm, parenting in poverty is seen as parenting under conditions of social oppression and human rights violation. What we can try to understand through the PEP is that the structural component of poverty in the child welfare system molds the way parenting goes, the way parents behaving. It's not two different things. It's not that there's the parenting and the risk and the poverty. They're intertwined, and I'll try to talk about it a bit later. And still, so why is it so hard to talk about poverty and child protection? I'll give some possible answers. I'm sure people here, there's a lot of knowledge, will have some more. What I thought about is, first, if we say that risk and children at risk and risky parents are the outcome of poverty, not only of parental behavior, so we say it's our responsibility as well. Because if it's poverty, we need to fight poverty. We don't need to help these parents to be better parents. So it means it's our responsibility. I think that's what the parliament member was because she says if it's poverty, it shouldn't be taking children out of their homes, because it's our responsibility as well. The second thing is that it requires major changes in policy and practice. I think we have a great example here, how the policy is changing, how PEP and the ministry are trying to do something, but they can tell you later how hard it is to change all these things. There's a big fear. I think all over the world social workers are called kidnappers. Tell us if, at least in England and in Israel, there's a big fear. Belgium and Denmark, it's like the heaven. Everything we say in the last 2 days, it's not like that in Belgium. I don't know why they came. Well, we just love it. So it's very frightening to say that what people are saying is maybe right. I think it's how we make the connection, and we can gain a lot if we are the ones that show the connection and say we want to fight it. But if it comes out wrong, and maybe people hear what they want to hear, it's very, very dangerous for us as a profession, and then we try to distance ourselves away from that. Lack of resources. If it's poverty, Al-Aluf Committee, we need a lot of money to make the change. I think even much more money than changing parenting is to change society, and that demands a lot of things. And I think another important thing, Michal just talked about it a bit earlier, about we don't want to say, it's really delicate that you don't say all parents in poverty are risky parents for the children, but you do want to say that there is a component of poverty in risky parenthood, and it's really delicate how to say that in the public. And so I think all these Anna, you want to say something?
No, I'm agreeing.
That's good. So how can we take all these things and make the denied evident? It's a big question. I'm very happy that people from the ministry are here because I think it's a task that social workers, academics, and the practitioners need to do together. And it's frightening as well. I didn't talk in the Knesset. After the Aleon, I was like, even though I was, but it's hard. It's very frightening when a lot of people say a lot of hard things to you. And now I'll try to take on what Will brought about the everyday practice of social workers and why we don't see the link. It's not only in the macro level, as social workers, and this I know from my practice as 5 years as a social worker before I met PAP, I didn't see poverty. It's not something that social workers do, it's how they're socialized. And I try to give 3 explanations for why it's so difficult to identify the relationship between poverty and risk, and I'll do it using my research that I'm in the midst of my research. I will use some quotes of social workers to exemplify how it goes, how these explanations work in practice. So first, I'll just go to it. It's an elusive relationship. You can't say, the relationship, because we say it's multidimensional, it's not one way. It's not material hardship means the child is at risk. Most of the time, it's much more. If it's only money, it's easier to help the parent. But sometimes it's much more the layers of how poverty and risk combine are intertwined, and it's very hard to see what is what. And so what we do a lot of time, we do a split. Okay, we see the risk, and we don't see the poverty because it's much more complicated. So the hardships of poverty and the hardships of parenting are intertwined, and they have mutual influences between them. That the next slide, that in order to see them, you need to change the lens. That's why it's a paradigm. That's why the poverty aware paradigm is helpful for me as a social worker. When I look at a family and I try to take decisions, I have an analytical framework to do that. So I want to give an example of Dina. She's a social worker in one of the programs that you'll see today, and she tells me about the family, and she exemplifies how elusive it is. So she says, in this family, all the poverty-aware stuff, I really told myself, was I blind till now? I came back from their home. They have 3 bedrooms. All the children sleep crowded in one room, and the father has a working room. And what does he have in the working room? A gym bike and a computer. I remember that when the family was referred to me, the social worker were like, the father, he has a working room, all the children sleep in one room, and he has a gym bike. And when I got there, we talked about it. So he told me, yes, I have diabetes and I must exercise. Without exercise, I will need insulin injections. When I went out of the house, I told myself, what would you have said about such a family in the past? How would you talk about them in the past? Probably I would say, what does he think to himself? That's what everyone told me about him. It's his room, he thinks only about himself, he doesn't care about his children's needs. Okay, and we see how complicated it is to see why does he have a bike. Why does it's 6 children in the family, they're sleeping in one room. And when you get into the house, it's easier to see the 6 children and the bike in a room and to start to deconstruct the relationship between that he doesn't see the children's need maybe because there are 6 in a room, and between the fact that the house is very small and he has diabetes, you need to do a paradigm change. And that's what she's telling us. This is a social worker that got PAP training. So that's what you say, all the PAP stuff. So the next thing is othering and distancing. I won't go into othering, we talked about it, but I'll say I want to talk about parental othering. I think it's othering less talked about, but the othering of the poor is translated a lot of time to othering of parents. And here as well, we have deserving parents and undeserving parents, I think. Parents that are known to be, it's only material hardships, we're much easier to help them than parents that it's intertwined, like I said earlier. And then you get and ask them differentiation, like we have in poverty, that's what Michal talks about, and us as parents are good enough, loving, child-focused, stable, and them as parents are a lot of time, of course, it's not always, but what we know about a lot of times, these families, at my work they call our families, the concept, our families are like, untuned to the child, self-absorbed, lacking parental capabilities and harmful. I'm saying that not because I think that in some ways, I don't think that, in some ways I'm part of this othering as well. As someone who's middle class, I always state I have like 20 stories about how when I became a parent, I understood that if I would have been a parent in poverty, I would have been maybe in the child protection system. Sivan and I talk about it a lot, because my parenting interpretations, my parenting gets, is much different than the families I work with. I'll give one small example. Let's say about families that sleep together in... Families that sleep together in one bed. You know, when I started being a social worker, what we would have said about families like that? No boundaries, no separation, individuation, you know, all kinds of pathologies. And then my son started coming every night. And then I found out that there are a lot of parents that believe that this is how it's supposed to be, okay? So it's how the same actions get different interpretations, and how the social worker can move all the time to see, you know, the differences and how we're the same, but our actions can get different interpretations.
I have to tell a small story.
Yes.
I was at a meeting with students and social students and social worker in the field practice, and they had something about child protection, and the officer, the Tzad, was talking about family, a case when then they didn't take the kid in the garden on time, and then the head of the department says, "Whoa, it just happened to me yesterday." But of course, that's okay.
Yes.
It happens to all of us.
So we have like dozens. Lice, they thought that lice is a class thing. Lice, do you say kinim? Yeah, I thought it's a class thing because a lot of time it's portrayed as neglectful and all kinds. Okay, so when you become a parent, you understand all kinds of things.
Just say, it's also cultural. My grandmother in India would have seen that abuse. You putting your child in another room. You sleep with your children in India.
Yeah.
You know, that's seen as the bond and that's the warmth. And so it's got
That's
that
the context.
Yeah, the context
exactly.
and the cultural lens.
And what research shows us, and Rudy and Rit are part of, there's a bias in the social work system about decision making towards poverty. We have something in Israel as well. Guy Enosh, he gave social work vignettes of symptoms of risk, and he saw that the evaluation is different between people in poverty and people in other social classes. It means that all of us are biased, not because we want to, but it's part of being a human in society. So I said about the similar actions, different interpretations. I'll give a small example. Ravit is going into a house, a social worker that had PhD training, like I said. So she said the children's physical condition is very, very neglected. There's something that the mother, she looks like $1 million. She walks and it was awful. I went to their home, and first of all, they have a dog. And there's a terrifying violence between the dog and the little girl. She grabs him and he bites her as if they're playing, but really, I have a dog at home, I don't have a problem, but there was something unpleasant. So we can see here two layers maybe of othering. First, she comes into the house and she sees the difference between the mother and the children, between the situation, and the fact that the mother looks good is already working against the mother. So we start, first of all, it's like a moral distancing that we do, that's othering. And the other thing is that the thing of interpretation, that sometimes you can take the same, I don't know what really happened and how bad the game between the dog and the child was, but the dog and the child playing, it really depends on how you understand it, because sometimes people who have dogs look at it different. And she's saying, I have a dog at home, but she's saying that not to see how they're similar, but to distance herself maybe from the parent. So it's another elusive and complicated way how things combine. The last thing I want to talk about is the professional perception of material needs. And this is, I think, about social work in general. It comes to hand in parenting and risk. So we see a hierarchy of needs and professional responses. If we treat parenting, that's our focus. How do we change parenting? How are we taught to change parenting? A lot of social workers, you're supposed to. We do an inter-psychological change, right? Or interpersonal change. We don't know that parenting is changing the context of the people's lives. We're used to help them change themselves.
Or a punitive change.
Huh?
Or a punitive change.
Or a punitive change, yeah. That you use your power to make people change. So that's why we don't perceive money as something that can be part of parent. This is changing, yes, now, today in the programs, but we don't see money as part of it a lot of time. And what happens is that we disregard many times the relationship between our inner and outer worlds. But that's a bit like what Will presented. You can't tell social workers it's important and don't give them the resources to give the bus ticket when they need to go. I mean, the social workers, he doesn't need to take it out of his pocket, he needs to have a flexible budget so he can help the parent. Because if we don't have the money, we want to avoid helplessness, and how do we avoid helplessness? We move our head a lot of time, and we don't want to see things in order not to stay frustrated. I'll give a last example about Dana. And it's a question I have all the time. It's not like only the social workers. You say, I can't say that if they had another 20,000 shekels a month, they will get better. I really can't say that. I think that it would give them more space maybe. Maybe they could move to a bigger house, but the pathology would stay. And that's a big question for us all the time. Will money solve the problem? Because parenting is not only money. And I think the challenge is not to do the split. We can give them the money, maybe they can move to another house, and then we'll see what happens with the pathology. But we don't need to choose. Okay, there's pathology in the world. I don't think there isn't parental pathology, and there are children in risk, and we need to take care of them. But what the context we do it in, and I think your research and project gives us a solid ground to do that. Yeah, I just because I couldn't. Resist, because we started conceptualizing practices that can help us do PAP in the child protection system. So we take the relationship-based practice and knowledge and we say you can't assess risk if you're not close enough, because you can't see the elusive relationship we talked about, so you need to get closer in order to do that. You need a flexible budget, because everything I said earlier. A tool that I find helpful for social workers when I supervise is that you can take the risk and place it in a different social context. You can take the risk symptom, let's say a dog playing at home, and ask yourself, how would you see it in another neighborhood? Okay, and it helps us deal with the othering mechanism. Because risk, when we see risk, what we want to do is eliminate it. That's how it is, and basically it's a good thing, but sometimes because you need to see the context, you need to hold the urge to eliminate the risk. That's very hard. You need a lot of supervision, you need a lot of backup, but something that can help seeing the context and not denying the link. And the last thing, because we have a lot of power, like Shachar said, there's always need to be in dialogue with the parents about who has the knowledge, what is the best interest of the child, and who has the power to decide about it. Because it's not objective and it's constructive. And in order to talk about the constructions of what's good parenting and what's bad parenting and what the child needs, you need closeness. Thank you.